I would like to share an interesting case report of a patient, middle-aged man, about 45 years. His name was Mr. Bassam, all the way from Yemen. So he had a gunshot injury in the elbow joint, for which his the vital organs around the elbow are damaged. Mainly the bones of the distal humerus and the proximal ulna are damaged. And he had undergone multiple surgeries in his country to debride and get the wound closed and healed. So after multiple surgeries, even though his wounds were healed and his the limb was saved, he was not able to do his activities of daily living, like using the hand for combing, eating, making the dress, or day-to-day activities, even writing or lifting the hand was very difficult. Problem with his shoulder was his bones were damaged. There was no joint. Literally, there was no joint. So his elbow was dangling. So patient was not able to hold the arm straight, because whenever he used to try to stretch the arm, the elbow used to fall backwards. So there was no hold between the upper part of the limb and lower part of the limb. So it was a challenging case for us. When I met him, when I examined him, literally the joint was moving in all possible directions. We could move the joint from front to back, left to right, and when I was asking him to hold the hand straight, the patient could not hold the hand. It was falling backwards, which is practically not seen among other patients. So he was very enthusiastic. He was working as a soldier in his country, and then he was eager to work back because it was a dominant hand, and he was feeling handicapped because of this. So I evaluated the patients. We did multiple investigations. We did CT scan with 3D reconstruction, and to understand what is the bone anatomy which is remaining and what best we can do. There are multiple challenges. One, the patient, it was a chronic injury which was gunshot, multiple surgeries done. The normal anatomy would have been distorted. Okay, so we had to consider that. Then second one is the bony structure is already, it was damaged and it was disorganized. And third is the problem with the skin. So after multiple injuries and multiple surgeries, the condition of the skin was not really great. So that was a big concern for me, because after the surgery, if the skin doesn't heal, then we have left with very few choices. And then the last option was whether his even though there was no injury to the nerves and blood vessels, I was concerned about his triceps and biceps, whether it will work properly or not. So after evaluating and thorough investigations, I came to a conclusion that yes, we can reconstruct this joint. I spoke in depth with the patient. I told him what all the limitations, what all the pros and cons, and what all the precautions he needs to take. And I also told him about the guarded chances that his hand will be completely normal. So that guy, being a soldier, was very enthusiastic, was very disciplined, and he was willing to follow all the precautions what I had told him. So finally we decided to go for a total elbow arthroplasty. So as I said earlier, we had to face multiple challenges. In spite of that, we did manage to get back his shoulder arthroplasty done, and it was successful. Patient wound coverage was also good, and his wounds, everything healed very well. Okay, and by 3 weeks, I was confident to take out his plaster. All the wounds are healed. I removed the plaster and started mobilizing. Within 3 weeks, his improvement was really good. He could able to bend the elbow, move the elbow, and he was he just tried to write and see whether he is able to perform the functions what he wanted to do. So it was an excellent recovery. It was like a bolt from the blue for the patient. If the hand was not able to hold in the air, he started moving, he was bending, he was making it straight, he was able to sign, write. So looking at the smile on his face, it made me feel that my job was 100% satisfactory. So I was very happy with the outcome of this very bad extensive injury, and he has gained back his elbow and the functions of his hand. And seeing the happiness of the patient on his face, it made me very proud as an orthopedic surgeon. So it was a very satisfying job.